Here are 7 non-residency paths of how you can be a doctor in Canada as an international medical graduate. And let's do this together. Hi there, I'm Dr. Rajiv Iyer, a double board certified doctor working in the USA for many years. I did my clinical fellowships at University of Toronto, and I do have a solid understanding of both the US and the Canadian systems. I also used to be a Canadian permanent resident at one point. Option 1 is called MLP IMG. Now this stands for the Medical Licensure Program for IMGs at the University of Manitoba. Applications for eligible family medicine doctors would be made directly with the University of Manitoba. And if you're selected to the program, which in other words means that you have secured a position, then your name would be referred to the College of Physicians and Surgeons of Manitoba for you to obtain a licensure. The requirements are you must have completed your medical school or medical college from a World Health Organized recognized training place with a sponsor note from the Medical Council of Canada. This is important. You only need 1 year of training in family medicine, including rotations in general medicine, general surgery, pediatrics, and OBGYN. Of course, you do have to meet current English language requirements, which includes exams like the IELTS or the OET and a few others. So the College of Physicians and Surgeons of Manitoba will evaluate your application and then make sure they check everything, and they would then decide to issue a licensure using which you can transition into this position through the licensure specific to the University of Manitoba. You do not have to be a Canadian permanent resident or a Canadian citizen for this. You could also apply for this technically from your home country, because if you do get successful, they would give you a work permit. Option 2 is an associate physician license in British Columbia. So once you obtain this associate physician license, then you can work under the scope of having this license based on your education qualifications. So there are a lot of specialties in which this is applicable, and we've also seen candidates in medicine and pediatrics and other places too. Now you have to remember, this is not an independent license. However, this experience can actually help you with two things. If you're not an outstanding IMG, then this can give you enough clinical experience so you can get back into residency. Or if you turn out to be an outstanding IMG, then you can directly obtain the job of a consultant or an attending physician in any province in Canada. And in fact, one of our own candidates has transitioned successfully from being an associate physician license to being an attending physician with a full unrestricted license. How cool is that? In this license, you would be working under supervision and are only allowed to practice or work in those places where you're authorized to work. Of course, I think that's true for anyone in any place. But sure, the licensure does mention this. Even in this case, you do not have to be a Canadian permanent resident, not a Canadian citizen. As long as you get a job, you will receive a work permit to transition to the province of British Columbia. How cool is this? Option 3 is called practice ready assessment. This is an option where an eligible international medical graduate can really transition very quickly into the Canadian system, usually in a span of 3 to 6 months. That's about it. You must have completed your PG training or residency from your home country or anywhere else other than the US or Canada, because if you're certified from the US, it's pretty much a direct entry into Canada, so you don't have to worry about anything else. Now currently there are 9 provinces which have the practice ready assessment in Canada. Each program offers a workplace based assessment for a period of 12 weeks, about 3 months. During this time, there are specific assessors within the hospitals who are called the practice ready assessment assessors, who actually supervise these physicians who come through the PRA pathway, and they're responsible for saying that this candidate now is familiar with the Canadian healthcare system and can now transition to become a fully licensed physician. So they're responsible for signing off, and once this happens, congratulations, you're now an independent licensed physician. We actually know of candidates who have transitioned through the practice ready assessment. The requirement is that you must have completed your MCCQ1 examinations for this. Plus, once you become successful, you have to sign that you would return service in that particular province. Because they helped you become an independent licensed physician, they want you to give it back to the province by committing that you would stay for X number of years in a province. We have heard this to range somewhere between 3 to 5 years and sometimes even longer. Now, some province may also require you to do the NACOSCI, but not all of them. And some provinces may also require you to do another exam called therapeutics decision making. Again, there are some province-based differences here. Now, here are the 9 provinces that offer the practice ready assessment pathways. It's Ontario, British Columbia, Alberta, Saskatchewan, Manitoba, Quebec. In Quebec, you have to remember that you need to be proficient in French language. So you would have to write a French language exam. The other provinces are New Brunswick, Nova Scotia. Nova Scotia has a particular program called the PACE program, and Newfoundland and Labrador. Option 4 is the approved jurisdiction route. In this pathway, if you're an international medical graduate trained from these countries, Australia, New Zealand, Hong Kong, Singapore, South Africa, Switzerland, UK, then you can directly apply to the Royal College in Canada to assess your credentials, assess your training, and they would give you eligibility to write the Royal College exams in Canada. This pathway does not require MCCQ1 exams because you've already completed all your training in a different country, which is considered equivalent to the training in Canada. So this is a direct entry to write the Royal College exams. If you're a candidate who have been through approved jurisdiction, and if you did write the MCCQ1 exam, we would love to hear this, and please post in the comments below. And then you would write the Royal College exams in your particular specialization. You pass that, fantastic. You're now a Royal College certified physician in Canada or a surgeon in Canada, and you would get a full unrestricted license directly, so you can transition directly to become an attending physician. How cool is this pathway? Now, what about if you're not someone from these countries? Then the other option would be option 5, which is the practice eligibility route. This practice eligibility route involves 3 major steps. It starts with registering with physiciansapply.ca, completing your MCCQ1 examinations, and then having all your credentials assessed. The Royal College would assess your credentials and determine that your training would be not fully comparable like the approved jurisdiction, but partially comparable, and then they would give you eligibility to write the Royal College exams in your specialty. So this would be step 2. You pass the Royal College exams, then they would require a currency of practice of up to 2 years in Canada, meaning you have to work in Canada in order to complete the last part of the practice eligibility route. Once you're through all this, that's it. You're now a Royal College certified physician with the full unrestricted license to practice anywhere in Canada. How cool is this? Option 6 and option 7 do not require any MCCQ1 examinations. So what is option 6? This is the academic licensure pathway, which we also refer to as a province-based specialist pathway. In this case, an eligible IMG who has already completed their medical school and also completed their residency, who do have experience in that specialty, who is considered eminent outstanding, which is the same pathway in the US, then these people can actually directly get hired as an attending physician in Canada. When they do get hired as an attending physician, they receive a license which is called an academic license. It still comes with the College of Physicians and Surgeons from that particular province, but this would initially be restricted to a particular place. In our experience, it takes about 5 to 7 years in order to achieve all this and then get promoted to the next phase, at which time your license would now be completely unrestricted. So there is no MCCQ1, you now have a full unrestricted license. Option 7 finally is a clinical fellowship, which is one of our most favorite option, and this is the path I took, and this option does not require any MCCQ1 examination. So once you finish your clinical fellowship, you can then approach the academic license pathway in order to establish yourself in Canada. Well, I have to mention the intent of fellowship is not that, but we have seen quite a few people who do get successful after clinical fellowships in establishing their career, either in Canada or in the US. So I did this in the US, and we do have extensive experience with all this. If you need our assistance with any of this, you're more than welcome to book an appointment with us at www.imgsecrets.com. We will be more than happy to talk to you and then explain you all these pathways and what's best for you and guide you accordingly. Next, I encourage you to watch these videos out where we have mentioned how you can be successful as an international medical graduate in Canada. There are quite a few videos that I encourage you to watch because this will give you extensive knowledge of how to approach the system and be successful with your career. Fulfill your dreams of working in Canada. Any questions, do post in the comments below. Take care, stay safe. I'll talk to you soon. Here are 7 different paths of how you can be a doctor in Canada without Canadian residency. No, it's actually not without. And I have experience with both the US and the Canadian healthcare system. And this is available for acute care, and this is available for acute care. In this license, you would be working under a supervision. In this license, you would be working under supervision.